another special class, and you will all be reporting. So please pick one, and the topic you will be reporting is written.
I love things.
Night before their reporting, Claudine started studying about her topic, botulism. Botulism is a rare but serious paralytic illness caused by a nerve toxin that is produced by the bacterium Clostridium botulinum, which is found in soil and in the gastrointestinal tract of birds, fish, and mammals, and sometimes by strains of Clostridium butyricum and Clostridium barati. Although it is usually harmless in a spore state, the organism flourishes in warm anaerobic environment, causing germination with bacterial multiplication and toxin production.
But the germs themselves are harmless, so they're not the problem. What happens is that the germs form a protective coating and become spores. This allows the germs to survive until they are in an ideal situation that can help them grow. But when they grow, they start producing poison, and this poison or toxin is one of the most deadly poisons in the world. Just a teaspoon of pure botulism poison could kill millions of people.
Foodborne botulism results from contaminated foodstuffs in which Clostridium botulinum spores have been allowed to germinate in an aerobic condition. This typically occurs in home canned food substances and fermented and cooked dishes.
Symptoms usually begin 18 to 36 hours after eating food containing the botulism poison, but they can show up as early as 6 hours or as late as 10 days, depending on how much poison is in the food.
Wound botulism results from the contamination of a wound with the bacteria, which then secrete the toxin into the bloodstream. This has become more common in intravenous drug users since the 1990s. The most common form in Western countries is infant botulism. This occurs in small children who are colonized with the bacterium during the early stages of their lives. The bacterium then releases the toxin into the intestine, which is absorbed into the bloodstream. The consumption of honey during the first year of life has been identified as a risk factor for infant botulism. Another kind of botulism is adult intestinal toxemia botulism. It is a very rare kind of botulism that occurs among adults by the same route as infant botulism. Lastly, iatrogenic botulism can occur from accidental overdose of botulinum toxin.
Anyone at any age can get botulism, but the only way they get botulism is when they eat food contaminated with botulism poison.
All forms of botulism can be fatal and are considered medical emergencies. Foodborne botulism is a public health emergency because many people can be poisoned by eating a contaminated food. Once ingested or embedded, the bacterium enters the vascular system. Botulinum inhibits the body's production of acetylcholine within the nervous system, the chemical that produces a bridge across synapses where nerve cell axons and dendrites connect with each other. All forms lead to paralysis that typically starts with the muscles of the face and then spreads towards the limbs. In severe forms, it leads to paralysis of the breathing muscles and causes respiratory failure. In light of this life-threatening complication, all suspected cases of botulism are treated as medical emergencies, and public health officials are usually involved to prevent further cases from the same source. History. The recorded history of botulism begins in 1735, when the disease was first associated with German sausage. In 1870, a German physician by the name of Müller derived the name botulism from the Latin word for sausage. Clostridium botulinum bacteria were first isolated in 1895, and a neurotoxin that is produced was isolated in 1944 by Dr. Edward Schantz. From 1949 to the 1950s, the toxin was shown to block neuromuscular transmissions by blocking the release of acetylcholine from motor nerve endings. Botulism toxins are some of the most toxic substances known to man. While the toxin has been considered for use as a biological weapon, it has also been used to treat many medical conditions. In 1980, Dr. Scott used the toxin to treat strabismus, deviation of the eye, and in December 1989, it was approved by the U.S. Food and Drug Administration, or FDA, for the treatment of strabismus, blepharospasm, and hemifacial spasm in young patients. The use of Botox to treat glabellar lines, wrinkles, and frown lines was approved in 2002 by the FDA for cosmetic improvements. The FDA, or Food and Drug Administration, has approved many additional uses. For example, underarm sweating, muscle pain disorders since 2002. Botulism can be diagnosed through several diagnostic tests, such as serum or stool toxin level and culture, and sensitivity from gastric, wound, or stool specimen. The test results are usually positive because of the presence of Clostridium botulinum.
An average of 110 cases of botulism are reported each year. Of these, approximately 25% are foodborne, 72% are infant botulism, and the rest are wound botulism. Outbreaks of foodborne botulism involving 2 or more persons occur most years and usually caused by eating contaminated home canned foods. The number of cases of foodborne and infant botulism has changed little in recent years, but wound botulism has increased because of the use of black tar heroin, especially in California.
Hi, my name is Piseth. I'm from United Kingdom, England, and I am one of the sufferers from botulism. In 1998, there was an outbreak foodborne in United Kingdom that 27 patients was affected by botulism and one died. 1 week before the onset of the symptoms, those people have eaten hazelnut yogurt that is stored in the cans, and after they eat, they have contaminated by botulism.
Hi, I'm Joan Clarisse Buenio from El Paso, Texas, and I am one of the survivors of botulism last April 1994. We got this disease when we eat a food named potato-based dip at a Greek restaurant. 30 of us were affected by this botulism and 4 required mechanical
Hi,
ventilation.
this is Hampson from Africa, Zambia. It was way back in 2007 with I and my family decided to go to the United States to go and visit my aunt there. I was very excited to test one of the foods. Unfortunately, I decided to eat a tinned fish which was contaminated with botulism. 8 of us ate that canned food. Unfortunately enough, we got sick of botulism. We were taken to the hospitals, and I realized that the signs and symptoms were severe. It was such a situation that told me to be careful in what I eat. Though I was lucky to have a chance of visiting there, but that experience taught me a lesson.
Hi, I am Carissa Palacol from Philippines, and I am a botulism survivor. That was in 1971, 2nd of July, when me and my husband went to New York to have our vacation there. We ate a bon vivant soup in a restaurant and started manifesting signs and symptoms of this disease called botulism. Signs and symptoms of botulism are abdominal cramps, nausea and vomiting, difficulty of breathing, blurry vision. Other signs and symptoms are double vision, drooping eyelids, slurred speech, trouble swallowing, dry mouth, muscle weakness, and diarrhea.
The healing hands of doctors and nurses help protect patients who have botulism. If diagnosed early, they can treat patients with a life-saving medicine called antitoxin.
That's better.
Antitoxin is not kept in most health clinics, but if needed, it can be quickly delivered to a doctor anywhere in the country.
Usually they're given a medication, an antitoxin, when it is first suspected that they might have botulism. And the sooner they get that, the better. It doesn't make everything go away that's already happened, but it makes it so that the toxin that's still in their body and hasn't caused a problem is less likely to cause further problems. We monitor how well their breathing is going, and it's getting worse, so oftentimes we've had to put a tube down into the lungs to help breathe for the person. They are moved into the intensive care unit where we are now, and we keep them on the breathing machine until they're able to support themselves. By a week, they're oftentimes much improved, although things are not resolved. Then he stays in the hospital for another week or so before they're well enough to go home.
If a patient has long-term problems with botulism, frequently they have to be hospitalized at our referral center in Anchorage for extended periods of time.
Home remedies such as taking aspirin, milk, or antibiotics, or drinking seal oil don't make this problem go away. The only treatment that we're aware of is an antitoxin, which you have to get by your health care giver, and then supportive care. We've had much improvement in keeping people alive with botulism.
What's your name, sir?
Hampson, Malekano,
Your address, please.
from AUP apartment E.
Okay, what happened, sir?
I ate the tin beef. From there, I started feeling stomach cramps.
Mm-hmm.
Then I couldn't see clearly. I was nauseated. I almost fainted.
So when do you think did this happen?
Just after eating the
Okay.
tin beef.
Okay.
No, Messi. How you feel, sir?
I have pain.
Right now we need to do a lava or enema for you. So first of all, you need to sign the consent form.
Okay.
Hi, good morning, sir, ma'am. You feeling better?
Yeah.
Okay, so today you discharge homes, and I just teach you something about your disease, the botulism. So, you know, the botulism is preventable, and the problem is you have to care about what you eat. So, you know, if you know, especially the canned food, if it is seared or is fallen, so you have to discard it away. And you know, if like you so like some vegetable or something, you have to cook in a real, you know, really good way, so it's not harmful to your health. So, do you have any question to ask me?
In conclusion, wash your hands, containers, and food before you start preparing food. Ferment food using proper methods where the air can circulate and the food is in the ground at a cold temperature. Also, salt your food when drying it. Most importantly, boil fermented food for 10 minutes before you eat it, and when in doubt, throw it out. By following these simple tips, you can give a helping hand and keep your family safe from botulism.